Well before I moved to Haifa with my family 5 years ago, I knew about the incredible work at Rambam. So it's a complete honor to be here today. Thank you for the invitation. Today I want to talk a little bit about exposures in Haifa, the unique risks from air pollution here in the Haifa Bay Area. I also want to talk about this elevated risk of morbidity and mortality, adverse health outcomes. And I want to talk about some specific challenges about how we can move forward in the future to assess these challenges and to try and tackle them. And I'll try and do all that within 15 minutes. Now, I'd like to suggest that despite all the media report, Haifa should be the healthiest city in Israel. And we already know it's the most beautiful, but I'd like to say that it should be the most healthiest. And why is this? Number one, we're blessed with wind coming from the Mediterranean. And the air pollution coming from the Mediterranean is virtually nil. On one side of the city, we're blessed with a tertiary care institute of Rambam that has an international reputation, where Professor Biar has come out verbally in the front pages of the newspaper saying that environmental pollution is a public health risk and it's something we need to be taking seriously. On the other side of the city is the University of Haifa, with the largest and most active school of public health, with the only dedicated department of environmental and occupational health in the country. And somewhere in between, we have a mayor who is actually willing to take a dump truck and move it across the city to block the factories to make sure that they don't pollute. And if you're not familiar with the story, it actually happened, and it made big news throughout Haifa and made a big impact throughout the country. Despite this, if we search air pollution in Haifa, there's over 44,000 unique articles about the link between air pollution and Haifa. Everything from young girl in Haifa, cancer sues, Haifa Bay may be declared air pollution stricken, 15% of cancer cases in Haifa are due to air pollution. The environmental ministry fines the Haifa port 3 million shekels. We can agree on one thing, is that the city of Haifa has a significant PR problem. But the question is this: is Haifa really that polluted? And then obviously we have to ask ourselves, what are the consequences, what are the health effects of that pollution? Well, let's start with the first question. Is there an increase of disease in Haifa? And unfortunately, there is increased morbidity, which is ill health, and increased mortality, cases of death in Haifa when compared to the rest of Israel. Number one, we see, as we've already discussed, that cancer risk and death rates increases between 16 to 48% in Haifa compared to the rest of the country. When we look at chronic respiratory conditions, we see 38% increase in diagnoses like asthma and chronic bronchitis, and 21% increase in hospitalization from these illnesses. As well, the risk of heart attack, myocardial infarction, is 42% increased risk here in Haifa than the rest of the country. As well, the risk of mortality, death from these heart attacks is also elevated for the citizens of Haifa. I want to just look at one of these research studies, a collaboration between our department in Haifa, Harvard University, and also the Hebrew University. We did a case control study where we looked at people with cancer and without cancer, and we divided them up by rates for different age groups. Here we see on the right-hand side, on the left-hand side, that in every single age group, we see an increased risk of cancer in Haifa compared to non-residents of Haifa. Now, this is strongest amongst children and young adults. When we see cancer amongst children and young adults, we have to ask ourselves, what is causing it? What in the environment, what in the occupation is causing it that's beyond old age and genetic mutations? Another interesting thing in the study that we found is that the risk of getting different types of cancer was elevated for cancers that are traditionally related with environmental exposures, like lung cancer, head and neck cancers, bladder cancers, all traditionally associated with environmental risks. So we've already noted that there's increased risk of ill health, cancer, respiratory disease, heart attacks, and mortality from those conditions in Haifa. But is there increased pollution? And is that increased pollution causing the increased risk of disease? It's a known fact that Haifa has the largest quantity of emissions in the entire state of Israel. And I think that this can be most concentrated in 4 unique areas. One is power production. 2 is transportation throughout the city. We have the port area, and then the industrial area, which produces 40% of all of industrial emissions for the entire country. Despite these 4 areas of exposure and despite the increased emissions in Haifa compared to the rest of the country, we see a very interesting decline in sulfur dioxide, which is basically a biomarker, which is basically an environmental marker for combustion and an indicator of how much industry is polluting. As we see from 2000 up until just 2 years ago, there was a significant decline in average and monthly concentrations of sulfur dioxide. And I think we can attribute this to 2 things. And I mentioned that there's 4 unique areas of exposures. 2 of them we've already done a lot about. The city has taken a lot of leadership in reducing exposures from transportation and from power production. In 2005, there was a dramatic shift in power production here in Haifa from coal to oils. And then in 2009, there was another shift to low sulfur oils. We see that those 2 shifts, those 2 policy changes, those 2 technological changes had a dramatic effect in reducing air pollution throughout the city of Haifa. As well, the transportation infrastructure changed dramatically throughout Haifa. In 2002, the central bus station here in Bat Galim was closed, which meant that every single bus going from the south to the north and from the north going to the south no longer had to go through Haifa, that they could stop and park outside of the city limits. And then in 2010, the Carmel Tunnel opened up, which meant that much of the traffic going through the city center could be rerouted and therefore decreasing pollution exposures. A PhD student of ours who's currently finishing up her postdoc at NYU did a time series analysis basically where she tried to associate the decrease in pollution levels with decrease in mortality trends. And she found that during those interventions, the past 10 years, there was an 18% decrease in mortality here in Haifa, a 40% decrease in cardiovascular disease, heart attacks, and a 27% decrease in respiratory diseases. Another thing that we look at when we want to talk about air pollution is particulate matter. Right? There's a good Yiddish word for that. That's basically schmutz. It's schmutz that's in the air. It's the smog. Now, if we compare particulate matter throughout the world, we see that some of Israel's cities are the highest in particulate concentrations. However, Haifa, notably, is one of the lowest of the major cities in Israel. Modi'in and Ashkelon got the recognition of being the most dirtiest cities in Israel when we talk about particulate matter. A lot of that has to do with construction in the area. The WHO cutoff for PM10, which is the larger type of schmutz, the larger particulates, is 20 micrograms. And in Haifa, we see that the level is just about the WHO cutoff, right? So on one end, Haifa is getting a bad rap. Everybody's talking about the air pollution in Haifa. And we do see that there's an increased risk of disease, but the question is it because of the air pollution? Now, I would like to suggest that there's something going on here that we're not exactly measuring. We know that Haifa has increased risk of disease and death. Yet we seem to see that there's a decrease of air pollution with all these changes that the city and the country has been doing. But I'd like to suggest that there's something within the air pollution that we're not measuring. And a lot of that has to do with those 2 exposures that I didn't yet talk about. 1 being the port, and 2 being the industrial area in Leva Mifratz. 1 is volatile organic compounds, 2 are persistent organic pollutants, and 3 are heavy metals. All of these things are basically chemical compounds that combine with particulates. So when we're breathing particulate matter, it's not just the schmutz that I'm talking about, it's not just dust. It's actually different compounds, whether they're organic compounds that persist in the environment like dioxin or PCBs or BPAs. Anybody with a baby knows that every baby bottle says without BPAs. Well, a lot of these particulates that are being emitted from the industrial areas have a lot of these chemicals in them, and we're just not measuring them on a regular basis. We did a small study where we looked at heavy metals and the particulates coming out of the Haifa Bay Area, and we found that they were significantly higher than in the rest of the country. So it could be that the connection between the increased risk of disease here in Haifa and the air pollution lies somewhere within these particulate matters. Just some more research that we've been finding is that here at Rambam, there's an increased risk of emergency room visits and hospitalizations on days where particulate matter goes up. And we've also found increased risk of a cardiac emergency room visits, such as heart attacks, on days when there's more metals in the air. Another study from our department looked at the risk of lymphoma throughout the city, and we did a mapping where we tried to trace air pollution as it went through the city, find out the areas of the city that have the most air pollution, and then trying to see whether or not there's an association between living in that area and having those cancers, and we found out that there was an association. So basically we know this. We know that Haifa has an increased risk of disease and also death. We know that although Haifa's air has been decreasing in pollutions, that there's lots of things we don't measure. And we know that people that live in the most polluted parts of the city had the greatest risk of disease. Two things we haven't yet talked about. One is the port. Now, there's a very strong literature in the scientific literature and the public health literature that living near a port is associated with disease. Another thing that I personally noted during my time living in Haifa is that one of Haifa's greatest assets is that we're surrounded by water on 3 sides. Yet, on 2 of those sides, citizens can barely even access it. And the port's a primary example. Somebody who lives in this neighborhood right near the port has a very difficult time crossing the roads, crossing the railroad tracks, and even gaining access to the port. This limits access to the water, physical activity, recreational. It also severely limits business activity in the port area, and of course causes air pollution. The city has taken leadership in this and has taken that old neighborhood right by the port and designed it into something new. It's called Campus Namal, the port campus. There's a lot of students living down there now. There's green spaces, there's recreational spaces, and there's a vision for having the Haifa port area be like Madrid and Barcelona, where people can access the water, and which would increase business, decrease air pollution, and increase the quality of life for the citizens of Haifa. There's other benefits of that, and that's walkability, something we don't talk about very much in environmental health. The more you can walk throughout a city, there's increased physical activity, which means decreased weight and hypertension, diabetes. There's decreased air pollution as people don't have to rely on car traffic. There's also economic benefits to the industry, safer neighborhoods, and also just a generally better community atmosphere. Another potential benefit of taking care of the port environment and turning it into a healthier environment. Now, obviously, there's future challenges. I'd like to recommend that we can look at the successes that we've already had in transportation and power production and try apply those successes to the port area and also the industrial area. We can also continue to significantly decrease emissions from the port and the neighboring industrial areas through communication, policy, legislation, and litigation. And then also a collaborative and coordinated effort between the city, the Ministries of Environment and Health, and the industry. And I think this is where Rambam has an important role. Right? Rambam is a leader of medicine and public health, not only in Haifa, not only in Israel, but throughout the whole world. If Rambam takes a position, as they already have, in being a leader in battling air pollution and the associated health consequences, I think this would benefit not only the citizens of Haifa, but also all the residents of northern Israel. So thank you again for the invitation, and look forward to the questions.